Hi, my name is Shaun Reynolds, and I practice in the University District of Seattle. I've been in Seattle at this location for approximately 6 years, but in the U District for almost 10. Been using ChiroTouch for 4 years or 3 years now, I believe. We've used several other software systems over the years, but ChiroTouch is a system that, or the first system that we used that encompassed everything, meaning the chart notes, billing, scheduling, and all that stuff. We see approximately 250 to 300 patient visits a week. That includes massage therapy, chiropractic, and as you can see, this is our open adjusting area where we do therapies, obviously adjustments, and our systems or our computers are all set up to do our chart notes in real time with the patients being on the table, so we can add subjective, we can add any objective changes. We can talk to the front desk through the computers and send them messages about things we might want to get scheduled for the patient before they leave, or about charges that they may need, or co-pays, or anything like that. The transition, and like I said, we've had more than one software system. This is probably our fourth, I believe, maybe third. And the transition is never a fun thing, but in the end it was very much worth it, because once you get all the patients inputted into the computer, now you have all of their stuff in just one area, which it did require a little extra work in the beginning, but was worth it in the end. ChiroTouch has been fantastic for technical support. Almost always when we call, we'll get to talk to somebody right then rather than leaving a message and have somebody call back. And very seldomly do they not resolve any problems that we might have right then and there. The nice thing that they do is they can hook into any of our computers, any one of them, it doesn't matter which one, and get to the problem and fix it remotely, because they take control of the computer and do everything for us. So once they're hooked in, we just don't have to worry at that point, and they can resolve any issues. ChiroTouch has not necessarily saved us time in real time, because before we used to use chart notes, just tick boxes for chart notes, which is really quite unacceptable now for the insurance companies, so you can't do that. So it does take more time to do a chart note, but because of the macros system and because of the way they've designed the all-in-one provider screen, that I believe out of any of the software systems that are out there is the fastest way to get that information in. And there's no doubt that ChiroTouch has made us more money, and that's simply because every time a person comes in for their visit, the all-in-one provider screen, you have to not only do their chart note, subjective, objective, assessment, and plan, which is great. I mean, it's no fun that you have to do that every visit, but it has to be done for the insurance company. So it makes you do that, which is going to ensure you get paid and ensure that you won't have problems with audits. But at the same time, you also have to look at their diagnosis. You have to assess whether or not that's an up-to-date diagnosis, whether it's an accurate diagnosis, and look at the charges. Now that stuff can auto-salt, which is same as last treatment, but you have to actually view it and make sure that it's correct. Another thing you can do is use diagnosis pointers, which are very quick to do, to attach a particular procedure code to a diagnosis, which makes getting paid much easier. So you really don't miss things, and people are, not only the doctors, but the billing people are double checking everything before they're going out, so we're just really maximizing whatever insurance benefits a patient might have and not missing anything. Well, they definitely notice things. Our patients, they pretty much just laugh most of the time when they come in here, because things are constantly evolving and changing, and I think I was voted by my patients to have the most computer screens in any chiropractic office in North America. So they do see the technology, and they appreciate that. I think they appreciate the fact that we're always trying to make things better. One thing that we're implementing right now is the use of, when we pull up a person's provider screen, it can have their x-rays, it can have their EMG scans, because we do EMG scans as well as all their chart notes, and so I can compare them from previous to current. We can look at where they were. So somebody, for example, who has a real negative curve in their cervical spine with anterior head carriage, and we do their first progress evaluation, take a re-x-ray and see total correction or some really good changes, I can show that to that person. So it's a real educating tool that people love to see that stuff.